If you are new to this channel, I am Dr. Himadri. Today, we will be discussing about measles. Measles is a very dangerous disease. These days, because of widespread immunization, measles doesn't occur. If it occurs, it doesn't causes very grave dangerous complications. But you should know that this disease is very dangerous. Let's talk about measles. So, what is measles? Measles is a very highly contagious disease. Okay, it is basically caused by a virus which is called as measles virus, and this is a RNA virus. Okay, with paramyxoviridae family, from paramyxoviridae family. Okay, look here. This is our beautiful measles virus, though it doesn't cause some beautiful thing in the baby. Look, actually, this is a RNA virus. You can understand this is a RNA as a genetic material in measles, and it has two very important molecule outside. One is fusion protein. When it comes and binds with our cell, it binds with this protein. Therefore, it is termed as fusion protein. It binds with the cell via this protein. And also there is something called as hemagglutinin. It causes main danger. That is the main problem in measles. Look here how this measles actually happens. So we will be talking about the pathophysiology. Suppose a baby come to my clinic and this baby is having actually rashes of measles. This baby is actually infectious, for 3 days prior even appearance of the rash till 4 to 6 days after appearance of the rash. This is the period of infectivity in case of measles. Suppose this baby is actually coughing and sneezing, when because of this coughing sneezing the particles are widespread within the air in my clinic. So and also it is viable for up to 2 hours. Okay. So what happens, our next baby who doesn't have measles actually visits my clinic just next to it. These small and large droplet particles can enter via conjunctiva and also via respiratory epithelium into this well baby. So what is happening now? Measles occurred in this baby. How? Look what is happening here. After entry, the virus actually multiplying into the respiratory epithelial cell like that, and eventually it comes and enters here in the alveoli. Within the alveoli we have one policeman. Look here, he is our police. So he catches it. Okay, the name is macrophage. Okay, after catching it cannot destroy it properly, so it basically goes to the local police station, that is our lymph node. Within the lymph node this virus keep on multiplying. So, and this phase is basically termed as primary viremia, when the virus for the first time keep on multiplying within the body. So what is happening? Look here, too much of multiplication that happened within the police station, that is our lymph node, and after that some viruses jumps into the bloodstream. This is called a secondary viremia, and the secondary viremia actually marks the onset of fever in this patient. Okay, and what happens, this virus eventually keep on going into the small blood vessels and eventually causes some forms of vasculitis within the blood vessels. Look here, the small vessel vasculitis, and this is what basically is responsible for your rash, and it happens on day 3 to day 4 of fever. Look, fever happens, and after fever, that means secondary viremia, and within 3 days this vasculitis happens. Therefore this rash appears on day 3 to day 4 of fever. Okay, so look here what is happening. This is your beautiful skin. Within the skin this viruses came, and few macrophages which are present here cannot handle it properly. Therefore these infected macrophages basically coalesces together. They join together and eventually form this multinucleated giant cell. We call it Warthin-Finkeldy giant cell. Just don't get frustrated. The scientist who basically discovered it named with his name like Warthin-Finkeldy giant cell. Okay, and another thing, here some epithelial cells are present, and this virus is also multiplying within the epithelial cell and leading to necrosis of the epithelial cell. Okay, and another thing, this measles virus is very naughty. It is basically multiplying within your T helper cell as well, leading to suppression of the T helper cell. Therefore there is immunosuppression. Okay, so transient immunosuppression seen in measles. Okay, so What are the different stages of the disease? Look here, the incubation period, initially 8 to 12 days. Incubation period means first entry of the virus within the body to first appearance of symptoms, 8 to 12 days. Followed by prodrome. What is prodrome? That is the secondary viremia. You know that fever, along with there is cough, there is coryza, there is conjunctivitis. And after that, there is something called as enanthema. It is basically marked by your coplic spot. Look here, this is called as coplic spot. By the side of your molar teeth, in the oral mucosa, there is some white spots. Sometimes the head of it could be bluish rather. Okay, so look here, this is coplic spot, this is also coplic spot, like that. Okay, now come here, and this is basically your prodromal phase, that is enanthema phase. And after that there is rash. If there is proper vasculitis, well formed vasculitis, it will cause the rash. Okay, after this coplic spot, usually within 1 to 4 days this rash appears. This is the classical rash of measles. So look here, what is the classical rash? Look, this is the classical rash. It basically starts behind the ear and in the mouth, and eventually keep on coalescing with each other, joining with each other, fusion with each other, and eventually whole body, this macular rashes, which is also basically given the name of red blotchy pattern of this rash. Okay, after that there will be recovery. Okay, so what is the disease course? In the incubation period, 8 to 12 days, followed by the prodromal phase. Look here, within the prodromal phase we have this fever, we have coryza, conjunctivitis and coplic spot. But in the rash phase, look here, the rash is prominent, and also it persists for up to 6 to 7 days. Okay, and after that there is convalescent phase. So I talked that the measles is very dangerous. Why so? Look here, there are few complications that can happen in measles. What are the complications? Most important complication is your otitis media, which is seen in children if the child is immunocompromised, especially if the child is immunocompromised from maybe severe acute malnutrition, or maybe due to maybe some immunosuppressive therapy, some steroids the child is getting, or maybe some chemotherapeutic drug which is causing immunosuppression. There could be otitis media and pneumonia. This pneumonia and otitis media caused many deaths earlier because of measles. But not only this, there could be some neurological problems. These complications are very dangerous. It can cause acute encephalitis, it can cause edema, acute demyelinating condition, as well as MIBB, that is measles inclusion body associated encephalitis, or maybe SSP. Look here, this SSP is a chronic thing. Okay, that is subacute sclerosing panencephalitis. I know that you know this name. Not only this, it can cause diarrhea, it can cause some pregnancy, bad pregnancy outcome, and even maybe death. Look, how we are supposed to diagnose this condition. Clinical features, which I have already talked, is just sufficient. But if you still very fussy about doing some kind of investigation, you can go for it, but not needed. Okay, usually total leukocyte count is reduced, neutrophil reduced, as well as lymphocyte count is further reduced. But usually PCR could be done, by serum IgM could be done, but not needed. Okay, and very important differential here is that measles versus your Kawasaki disease. In case of Kawasaki disease, what happens? Child is much more toxic, and also there is periangal and also perianal region desquamation, which is not seen in measles. And another thing, from second week onwards, that is after first week, there is thrombocytosis, increase in platelet count, as well as there is platelet activation, which is seen in Kawasaki disease, but it is not in measles. What is the treatment in measles? Usually not needed, no treatment. Look here, in acute measles, no antiviral, no antibiotic is supposed to work, but oral hydration should be proper because there is fever. PCM, paracetamol, should be given. And another thing which is given as per WHO guideline, all should be given with vitamin A, because measles basically lowers your vitamin A level in the children. So supplementation of vitamin A is important. In case of less than 6 months, give 50,000 unit. In case of 6 months to 11 month, 1 lakh. More than 12 month, 2 lakhs. Just remember this value: 50k, 1 lakh and 2 lakh. Less than 6 months, 6 to 11, more than 12, or equal to 12 months after 1 year. Okay, dose is once daily. Okay, once daily for 2 days. This is the dose, and nothing should be done. But in case of severe acute malnutrition, another repeat dose should be given after 2 weeks to 4 weeks, depending upon clinician. Okay, and another thing, in acute measles, With immunocompromised state like chemotherapy or something else like long-term steroid therapy, you can use ribavirin. This is an antiviral which could be used in case of acute measles. Okay, plus minus IVIG, that is immunoglobulin. That's all. This is all about measles, but there is, because of MR vaccination, widespread MR vaccination in India, measles incidence has been reduced dramatically, and the death also because of this. So stay healthy and read well. Thank you. I will see you in the next video, and don't forget to subscribe.